were a couple of important studies. There were two confirmatory big studies which were relevant, right? One was tension. And we were lucky to be a participating site in that study with the group in Germany. So in our group in Calgary. So that was the study looking at the large core infarcts. And they did a similar to Tesla, got a study which was presented at the European meeting earlier this year. They used simple imaging, so simple CT scan to select patients, and then they showed essentially that endovascular thrombectomy was an effective treatment, even in this group of patients. Simple selections, plain CT scan, CT angiogram to confirm a blocked artery, big strokes, low aspect scores, and endovascular therapy was clearly beneficial in this group. That's a confirmatory study, but really, cements the evidence and helps us understand how to treat patients with simple diagnostic imaging. Keith Muir presented the ATTEST-2 preliminary results. He hasn't got all of the SAE data and that kind of stuff in yet, but it seemed to confirm the results of the ACT trial, which was looking at Tenecteplase versus Alteplase in clinical routine, early window. And it seems that Tenecteplase is certainly non-inferior and probably very slightly better than Alteplase for treating stroke, and the dose of 0.25 milligrams per kilo. So that's exciting. That's confirmatory. I mean, I think certainly in Canada, where I am, most centers after the ACT trial, because we did that study here in Canada, we moved to switched over to Tenecteplase already. So for us, that's helpful, but it's confirmatory data, and I think it's great for the rest of the world. And certainly great for stroke because it's far easier to treat stroke patients with a single bolus injection of Tenecteplase than to use an infusion. So that was really interesting. And then we had the other results were the ANNEXA-I study, which was looked at Andexanet for patients with hemorrhage associated with direct oral anticoagulant. So this was an antidote medicine, and it looked promising, right? It was a surrogate outcome of restoration of clotting status, right, measured on the lab, but still looked interesting that would be a useful drug. And I think my understanding is that there's the pharma company AstraZeneca is going to be trying to pursue a license on this basis. So that may come into another drug which might come into our armamentarium for treating hemorrhage, which is really good. So those are a couple of highlights. And then, of course, it was just nice to see lots of folks and friends and that was good too.